All right, our politicians out there, the media, Wall Street, and all the rest of them looking to change your retirement age to 70, 69 years old. Absolutely. I've got the proof here. We're going to go through that. I'm going to show you some kind of midnight deals when they attempted to change the retirement age to 69 or 70. That happened earlier this year. We have to watch out for that. Right now, there's some videos out there, social media. I think it's AI generated that it says, oh, the full retirement age is 70 years old. Right now, no, it's not. And we have to make sure it doesn't change to 69 or 70 years old. What they are, a lot of these are foreign accounts. There's one out of Spain that does a lot of Social Security type stuff. They don't know anything about Social Security, but they get a bunch of clicks. The full retirement age is, fraud. It's 65, 66, 67. If you were born in 1960 or after, your full retirement age is 67 years old. However, what these social media people don't understand is there's what's called delayed retirement credits, where you can delay your retirement after your full retirement age and get 8% per year until the month you turn 70 years old. Once you turn 70, your benefits don't increase anymore because of your delaying. So it's delayed retirement credits. Your spouse, your current spouse, doesn't receive those delayed retirement credits, only a surviving spouse. So is the full retirement age 70 years old? Yes. Again, if you wait till after your full retirement age, 66, 67, 66 and 10 months, if you wait until 70, you get even more. That's another social media people out there saying there's checks coming this month for over $5,000 from Social Security. Yes, for a very, very small percentage of people that paid the max into Social Security for 35 years and waited to receive their benefits at 70 years old so they could get the 8%. Basically 24% after waiting 3 years. So yeah, there is a handful of people, figuratively, I guess, that are going to be receiving $5,100 this month because that's what they received last month and that's what they'll receive next month. And so, yeah, so social media people out there keep playing with these things in order to get clicks. But we're serious here. And the thing about raising the retirement age, if you were born in 1960 or after, you are losing 13% of your benefits. Done. Your benefits are cut by 13%. If you don't think so, then you got to run the numbers. And you're saying, no, Ed, I'm going to wait until my full retirement age so my benefits won't be cut by 13%. There you go. You just answered your question. You're going to wait until your full retirement age, which is 67 years old. If you were born in 1960 and after, your full retirement age is 67 years old. You're going to wait until 67 years old because they raised the retirement age to 67. This happened in the early 1980s. Under the Reagan administration, they raised the retirement age slowly. Now your retirement age is 67 years old. So you're missing 2 years of benefits. If they hadn't raised the retirement age, you'd start your benefits at 65 years old and you would have gotten 2 years of full checks. You lost 2 years worth of benefits. And you're like, well, I'm just going to go ahead and retire at 67. Again, your benefits are going to be reduced for those extra 2 years. So that's how the numbers work. If you were born in 1960 or after, you've lost 13% of your benefits over your lifetime. If you wait till your full retirement age, you get the full benefit. You lost those 2 years. If you file at 65, you're getting a reduced amount because your full retirement age is not 65, it's 67. So that's how the math works, unfortunately. So our job, this is why I'm doing this video, our job is to make sure that politicians don't try to do this again and raise the retirement age. And the issue is that the trust fund is running out. And the trust fund is just savings, and savings invariably run out. And what's going to happen in 88 more checks, everybody's going to get a cut, everybody, of 23% cut if nothing is done. So we have 87 more months to jump on our politicians and get them to do something. We have been a total failure of this for the past 40 years. This is why we're in this predicament. And that's exactly why these politicians are starting to float these ideas And not only the politicians, but we've got a lot of the media out there. So I've got a little clip today I want to go ahead and show of exactly what's going on. This one is on Fox News. So let's go ahead and listen to that.
I mean, the national debt is rising at an alarming rate. It is now nearing $38 trillion. As you know, that equates to more than $326,000 of debt per American taxpayer. My economists are warning of a weakening American dollar, other impact as well. Your reaction to this and the solutions that we need?
You bet. We have a very serious problem, and the first step is to actually talk about it honestly. Instead of politicians promising the sun, the moon, rainbows, unicorns, all sorts of things, we need to start talking about the situation as it is.
Okay. All right. Good. We like that. Yes. We need to, politicians lie all the time. They make all kinds of promise. They trick us into, fraud, waste, and abuse. And as soon as they say those magic words, we can do, they can do whatever they want. If they say illegal alien, they can do whatever they want. Even though, anyway, that's a distraction. But she said, okay, we need to be honest. The number one thing, we need to be honest. And guess what? Then, yeah,
going to
you already
reach
know.
record levels of debt never seen in this country before in just a few years. The problems start with looking at where the growth in the budget is. The largest areas of growth come from retirement and healthcare, and disturbingly, interest on the debt, which is growing faster than any other government program. Now, the things that I'll say are the opposite of what politicians say because they're not willing to level with American people, but we have to fix Social Security.
Okay. Yeah. So it's not the fact that we gave trillions of dollars of tax breaks to the most wealthy, the biggest corporations. That's not it. The issue is Social Security, which does not add one penny to that $38 trillion. Social Security does not add one penny to the federal deficit because Social Security is funded separately through your FICA taxes, your Social Security taxes. So it doesn't come out of the national debt. It doesn't come out of that. So she's saying, okay, we need to get our house in order. And in order to get our house in order, let's focus on the next door neighbor. All right. So she's not coming out to a good start here. And she comes up with some solution to fix Social Security. And here's a pop quiz. She's going to come up with 4 different solutions. And guess which one she decides to focus on?
It becomes insolvent in 7 years. We need to look at reasonable things like means testing, raising the retirement age, lifting the payroll tax cap. We have to change the way the healthcare system is delivered to generate savings. And we have $25 trillion in tax breaks over the next decade. We could limit a lot of those and help start to close this gap.
Okay, so means testing. What does she mean by that? Means testing. It's basically that, okay, Social Security is kind of a progressive system right now. If your average earnings throughout your life was about $1,000 a month, you're going to get a 90% replacement rate. So that means your Social Security check is going to be $900. If your earnings throughout your life was about an average of $10,000 a month, you're only going to get about 34% replacement rate. So your monthly check is going to be about $3,400. And so it's progressive. It's all, unless you're one of those federal employees that got advantage of the Social Security Fairness Act under Biden, which was a terrible law. They don't get that. They get extra percentage, which is, it's called the Social Security Fairness Act. It's completely unfair. But anyway, the other 97% of us, get those numbers. And so she's saying, okay, a means tested. She wants, there's ideas out there to go one step further and said, okay, hey, if you're receiving a Social Security check, but you've got millions of dollars and you got, millions of dollars coming in every year or something like that, maybe, you shouldn't get your benefits. Or if you have a spouse that's in that situation and it's still married and your spouse is getting, $2,200 from Social Security, maybe not get that. We'll put that back into the pool. So that's one idea, means testing. And is she going to talk about that? No, obviously. She talked about the raising the payroll cap. The payroll cap is if you make under $176,100 this year, then you pay Social Security on every penny you make. If you make over $176,100, you stop paying Social Security FICA tax on all the monies after that. So that's that is the biggest issue. That's what my community here, that's the number one thing we advocate. And do you think she's going to talk about that? No. And then she says, hey, we've also got all these tax breaks for these billionaires and millionaires and these rich corporations that would just pass part of the one big for beautiful billionaire bill. Maybe we could roll back some of that and pay off the debt there. You think she's going to talk about that? So there's 4 things she could have talked about. 4 things she could have talked about. And guess which one she's going to focus on? That's right. You passed the quiz. 100%.
Yeah, it's a great point that you make, particularly about the Social Security age issue, because that seems like an easy one. It wouldn't affect the people who are very close to retirement. They're going to get what they expected. But younger people who may not even be expecting it, why not move the retirement age higher, given that we're living longer?
This is the same thing they said in the 1980s. Hey, it's not going to affect you. It's going to affect your kids. And so they're expecting you to do the same exact thing this time around is, hey, it doesn't affect me, it affects the kids, future generations. Screw them. So this is exactly what happened in the 1980s. That one, most of the people in my community argue that raising it from 65 to 67, okay, we can see that. But anything beyond that is probably just too much. If you've got an easy job like they have, or like I do right here, sitting in front of the camera and talking, then maybe 69, 70. But a lot of people out there, my mother worked as a waitress in a breakfast diner. My father was a long distance truck driver. You just can't do that till 69, 70, 71 years old. Those manual jobs, you just can't do it. But the people that are making these decisions don't have these manual jobs, and they don't care about Social Security because it's just a small little pittance. One thing, the framing of this. So she talks about 4 different things, and then she immediately focuses on raising the retirement age, which will affect the poor people, vulnerable people the most, those people that don't have a lot of income. This has happened for decades. I'll give you an example here. If you ever watch a movie, sure, everybody's watched a movie, and you have the bad guy and the good guy, and the good guy is coming after the bad guy. And in order to get to the big bad guy, rich, genius boss, the good guy has to go through hundreds of henchmen, and he shoots them, kills them, cuts off their head with a samurai sword, whatever the case may be, and then finally gets to the big boss and then pins them down and says, well, I'm going to put you in, I'm not going to kill you because that's bad. And then I would be a bad person too. I need to make sure you face justice and stuff like that. He just killed the 100 poor henchmen, but the rich person, what's the difference? Well, the rich person is rich and has to, justice has to be served. You just killed these other 100 guys. They're poor. So that's the kind of mentality we've been kind of dealing with for decades, and, this is, books and all the rest of it. It's always, it's the henchmen, they're poor, who cares? But the rest of the people, yeah, we need to make sure they face justice. So that's the kind of mindset that a lot of us have.
Absolutely. It could be win-win in terms of expectations. Yeah. When the program started, retirement age was 65, life expectancy was 62. So it made sense. Now the retirement age is up to 67 and life expectancy is in the 70s, 80s, 90s and growing quickly. Young people don't think they're going to get anything like you just said. So if we can lock in benefits, but you are expected to work longer, assuming that you're able to, they would come out ahead of where they think they're going to be. Nobody's touching current retirees' benefits. The AARP should stop trying to scare people and help become a part of the solution here. And we should talk about adjusting the program for the things that have changed in the way that we're all living our lives. So that's a great place to start. Everybody behind the scenes knows that it makes sense. It's just that politicians keep demagoguing it when it's a very reasonable policy.
Yeah, and by the way, I have asked Frank Bisignano this same question, and it seemed to me that he was thinking about that, and that was certainly a serious contender on the table. Of course, Frank Bisignano, the head of Social Security Administration, was just promoted. Scott Bessent made him the new chief executive officer of the IRS.
All right, yeah. So the current commissioner of Social Security went on a news thing, and they said, hey, what are you doing to fix Social Security? And said, oh, everything is on the table. and they're saying retirement age, and then immediately had to walk that back because President Trump said, no, we're not going to raise the retirement age. So there wasn't, so that's good. So the president is on record. So there has been attempts to raise the retirement age. This happened, let me show you, this happened in January of this year, actually December. And when they passed that, Biden passed that terrible Social Security Fairness Act, Rand Paul, Republican out of Kentucky, and tried to add an amendment to adjust the early retirement age, to raise the retirement age to 69 years old. So that was an attempt. Luckily, that was kicked down, but this is probably how it's going to happen, is one day we're going to wake up and, the next day, and all of a sudden something was done in the middle of the night. This is supported by the House Republican Study Committee to raise the retirement age. 176,000 House Republicans said they want to raise the retirement age. And it says right there, yeah, this would decrease your benefits by 13%, because every year you delay retirement, it's 6.5%. And so this is, and then the other thing, they were also requesting, that means test for retirement benefits. But the big one is raising the retirement age. So I'm not exactly sure how y'all are up on it in terms of whether you want the retirement age to be increased. As I mentioned, the big solution here that a lot of people have is the fact that raising the FICA cap. If you make $50,000 a year, you pay 6.2% into FICA on all $50,000. If you make $500,000 a year, you don't pay FICA tax on that money. And people say, well, if people, that make $500,000, $5 million, $50 million pay more into Social Security, they'll get more as a larger Social Security check. So their Social Security check will be, $200,000. No, again, the way the benefits are calculated, you have a 90% calculation, 32% calculation, a 15% calculation. They're called bin points. So that's what as I mentioned, if you make $1,000 throughout your life, your average, you're getting a 90% return, a replacement rate. If you made $10,000, you're going to make about a 33% replacement rate. So if you're making $1 million, then we just make the replacement rate, we add another bin point there and make it 0.01% or something like that. And then, name a dog park after them or something like that. Thank you. So that is the situation there, raising the retirement age. So we need to make sure this doesn't happen in the middle of the night, and we make sure we don't sell out our children, like essentially what happened in the 1980s is, hey, it doesn't affect me, we don't care. All right, let's go ahead and get into some of the questions. This is also a live Q&A. So if you got any questions, make sure you add them to the live Q&A, and I'll get to as many as I possibly can for the next 45 minutes. I'm 65 and now getting disability for the first time. Only $967. That cannot pay my rent. Can you shed some light on this? Yes, you are receiving SSI, which is Supplemental Security Income. It is a welfare-based program that the Social Security Administration administers. Low income, low resources. So if you're single, your max resources that you can possess is $2,000. If you're married, $3,000. So yeah, you're receiving SSI. Because you're 65, you could also be receiving Social Security disability benefits, SSDI. And so let's say you're receiving $100 from SSDI. So you're receiving $100. The max you can receive from SSI is $967. So you're receiving $100 from there and then $867 from SSI. So conceivably you could be receiving both. In terms of SSI, once you hit 65, it's not a disability type thing anymore. People can get, so this is important for everybody out there. Let's reach out to everybody we possibly can that are struggling. So if you know someone that is 65 or older or disabled, but just didn't pay into Social Security for whatever reason, they were, stay at home mom or pa or whatever the case may be, there is SSI, Supplemental Security Income. And again, low income, low resources, the max you can get is $967. If you're under 65 years old, you can get it based on a disability. When you file for Social Security disability, they always address what we call both programs, Title II and Title 16. Title II of the Social Security Act, which is SSDI, Social Security Disability Insurance, and then Title 16 of the Social Security Act, which is SSI, Supplemental Security Income. So you are receiving SSI. So on my website, mygovexpert.com, I have living on Social Security alone, all kinds of different programs. I've done a bunch of videos on living on Social Security alone. If you look in my description of the video, you'll see a video that I did a few months ago that goes through about 50 different programs. But the number one thing that you should do is reach out to your state Medicaid office and apply for Medicaid. I'm not sure if you're eligible for regular Medicare since you're 65. So if you paid into Social Security any amount for 10 years, well, not any amount, but if you paid into for 10 years, then you should be eligible for Medicare. But if not, at the very, very least, you should reach out to and get Medicaid, get the extra help with your prescription drugs, any type of food stamps or anything like that, SNAP benefits. Were you married to anybody? Are you eligible for any spouse benefits? When you file, when you get SSI, they're supposed to check that, but make sure they check that. If you're eligible for any benefits on a spouse's record, a former spouse record that you were married to for 10 years or longer, or that you were married to when they passed away. So there are some other benefits. A lot of those other benefits that going out there to the most vulnerable populations are being cut left and right because of the big, beautiful bill. Medicaid's being cut, Medicare's being cut, food stamps are being cut, affordable housing is being cut. But consolation prize is a bunch of billionaires get to buy a new yacht so they can enjoy the French Riviera next summer. So I guess that's part of the beautiful bill. Senior age, low 60s, gets SSDI about $1,500. Workers' comp, $1,400. Could he get Medicaid? Okay. User K5S7Q. You're our first hero of the day. You're looking out for someone else. You are too awesome. So we appreciate you. All right. SSDI 1,500, workers' comp. It's important that we don't want this person to get overpaid. When a person gets workers' comp, public disability benefits, not private, long-term disability or short-term disability. We're talking workers' comp from the state, the government, the county or whatever. That money just might offset what they're receiving from SSDI. So hopefully when the local Social Security Administration adjudicated that claim, your friend told them about that workers' comp benefits, because they will find out. They will find out. So I would, number one, pull that Band-Aid off and just say, you know what, rather than having a nightmare in the future, contact Social Security and say, hey, I just want to make sure that you included this workers' comp, or does this workers' comp, again, if it's a private one, it doesn't count. But just ask them, just to be on the safe side, and make a little note of that. I contacted the Social Security Administration on October 13th, and I asked them about the workers' comp, and I told them where I was getting it from, and they say, no, it doesn't affect your Social Security disability. And then you just write down the name and everything like that, and you go on with your life. Okay. But if you're receiving $2,900 Medicaid, yeah, probably not. Probably, particularly if you're like in Texas or Alabama, which has the lowest. Even the highest would be like California. You can make up to like $1,800 or so and still get Medicaid. But yeah, getting $2,900, no. The person will get Medicare. So SSDI, when you're on SSDI for 2 years, 24 months, the 25th month, your Medicare kicks in. So normally everybody gets their Medicare at 65, but if this person's on SSDI, then they will get their benefits, their Medicare benefits at, looks like if they're 60, 62. So a few years early. So definitely check that out. And then thank you for looking out for other people. And sorry for the kind of baddish news there about that workers' comp, but hopefully it doesn't count. And hopefully they took it into consideration. So, but they will find out eventually. And it's a nightmare if they find out a year or 2 years down the line, then that person's got a terrible overpayment and everything gets messed up. So it's just good, just go ahead and get addressed. From the beginning. Somebody's talking to other people here. Perfect. Got an awesome community here. Bella, what's up, Bella? 87 paydays until Social Security payment reductions, unless the FICA cap is lifted. 7 years ago would have put us a level account at this point in time. Yeah, and people say, well, it's 7 years. That's what the problem is using young people is, young people don't even care. Well, young people don't care about anything. You know, in your 20s and 30s, you know, being our age, you never thought you never think you're going to attain that age in a million years. So you never think about it. So the whole argument about, young people don't care. Young people don't care about that crap at all. So 99% of them out there, but yeah, 7 years, 7 years ago, Black Panther came out, the movie Black Panther, Bohemian Rhapsody came out, 7 years. That seems like it was just yesterday. Right. And, so 7 years from now, we're like, we were just talking about this yesterday, that people should do something, and they've had 40 years. I noticed that this is the first year that I didn't receive a health insurance premium rebate check under 80/20. I guess the billionaires got that money too. I'm not sure about a health insurance rebate check under the 80/20. Not sure what that is. Is that the Affordable Care Act, something in there? There are Medicare Advantage Part B give back plans where the health insurance company, if there's one available in your area, will pay for part of your Part B. But yeah, if you didn't sign up for that last year during the annual enrollment period, then you're not going to, you won't get it this year. And if you're looking for that for 2026, if you want the health insurance company to pay for part of your Part B, the $185 or whatever it's going to be, $200 or whatever, then you need to sign up for that particular plan, see if there's one available in your area. But those are two ways you can get your Medicare Part B paid for. One is Medicaid, applying for Medicaid, and the state will pay for your Part B premium if you get at the higher levels, or one of those Part B give back plans where they pay for your part of your Part B. But be careful of those, because, I have to think of it in terms of $1 billion health insurance company, and these, they're not going to pay $50, $100, $185 a month for your Part B and not take it out of some other place. So if you're young and healthy-ish, roll the dice and get some money back for a year, and then next year switch to a better plan that covers more. So just be careful on those. A lot of people, got an extra $100 a month. That's $1,200. My wife and I, that's $2,400. Took a nice vacation, Even with the shutdown, I received my Social Security check 5 days early. Typically, I'm scheduled for the third Wednesday of the month and received my check last Friday on the 10th. Yeah, it's a holiday weekend and stuff. Yeah, the checks are still going out. It's just the people that are having people that are, their checks, their claims are pending in terms of retirement, survivor benefits, particularly disability benefits. They are all going to be delayed because they just don't have staff at the offices. And this has been going on for a long time. It has nothing really to do with the shutdown. The shutdown and the extra cuts that Russell Vogt is making hasn't made its way to Social Security yet, because they have already cut 7,000 employees from Social Security. So Social Security is already hurting terribly. Even before Doge and Elon Musk came in, Social Security was already hurting. And that was the whole point, is to make it as difficult as possible for you to get everything you're eligible for. And they're succeeding perfectly. Silver Dust, right now I get Social Security. Along with that, my wife gets a spousal support amount. It's a bit over $900, along with mine. If I pass, I know she can get my Social Security, but will she be able to, and that got cut off, keep her spousal support? I'm not exactly, what are you talking about, spousal support? Yeah, if that's something outside of Social Security, you're giving spousal, she's getting that from some other ex or something like that. So yeah, I'm not sure what you're referring to in terms of spousal support. But yeah, if she's getting benefits on her own record, and then she's also eligible for some money from yours as a spouse, because her benefit amount is less than half of yours, then she's entitled to up to half of the difference between hers and yours. So she could get two checks, benefits on her own record and benefits as a spouse. If anything should happen to you, then her benefits will basically, if she's her full retirement age at that time, she'll essentially get how much you were receiving total, not 2 checks or not the 3 checks technically. But if you're receiving $2,800 a month, let's say, and then you pass away and she's her full retirement age, she'll get $2,800 a month. So that's pretty much how that works. Pay into it for 41 years, and within 2 years of starting in at 62 with a 30% decrease already, and now you have to worry about the age changing. Yeah, they never really do that in terms of if you're already receiving benefits, as you know, they mentioned, they always, you know, make us, you know, throw our kids under the bus, basically. So yeah, they wouldn't do it where it says, okay, if you're currently receiving benefits, then we're gonna, you know, hey, you're 67 years old and we're going to stop your benefits and make you wait till 69. No, they're not going to do that. They always make it, you know, make us, you know, sell our kids. And because we want to keep our, but in terms of the cuts, that, because we've known about the cuts, we've been told, people say, they've been talking about this since Reagan. Yes. Why haven't we done anything? I get a lot of comments. Ed, you're talking about the same thing they've been talking about for decades. Yes. We've been told for decades that we need to turn the Titanic to avoid that big iceberg. We've been told for decades, and we're just plowing right ahead, right into that big iceberg. And so I'm not going to stop talking about it. So, because we've been ignoring it for 40 years. So my regular viewers, I know, but we get new viewers to our channel every single day. So we want to make sure that those new viewers know that, hey, it's going to be cut, and it's going to be cut for everybody. So, and how can we solve that? Get rid of the FICA cap and the means test so millionaires can't collect. Yeah, there's, to get rid of the FICA cap, that would have been 100% of the solution 3, 4, 5 years ago. But every year we wait, it's less of the solution. Like this year, I think it was, the last I looked at it was about, it fixed 73% of the problem. So we need to find 27% more solution. And the Social Security actuary, anytime some politician or think tank has some bright idea how to, you know, make sure our benefits continue for another 75 years, they send it to the actuary. That person gets out their giant calculator and they run the numbers. And they say, okay, here, if we do this and we do this, that'll solve 5% of the problem, 10% of the problem, 70% of the problem. And he has a whole spreadsheet of dozens and dozens and dozens and dozens of ideas. And the big one is raise the FICA cap. But right now, because we're waiting, it's only going to solve 70% or so of that problem. So we just need to find another 30%. So, and that is one of those options, means testing those benefits. So, let's see, question on how to locate past tax years 2 to 3 decades past. I saw someone ask that a few days ago. No answer. I too tried EDD, SSA, IRS, no bueno. Any ideas how to locate them? Appreciate it. Yeah. You can get what it's like I forget what they call it. I never worked for the IRS, so, you know, but it's kind of a report card, not a report card. It's your kind of, you can go on irs.gov and request the entire layout of all what you paid into what you paid into the IRS. And if not, then if they don't have it because your tax person didn't file it or whatever the case may be, then yeah, you need to go to your tax person and see if they have those records, those past records. Oh, Deb donated $9.99 to the cause. Thank you very much. I appreciate it. And she asks, I'll be 64 in January and am retired with a disability and receive survivor benefits. I'm trying to wait until 67 to draw my Social Security. Is that wise, or should I start now? Okay, so she's 64. She started her benefits in January, and retired with a disability. So okay, so you started disability benefits this year. So if you are receiving disability benefits on your own record, then yeah, you've already started benefits on your own record. And when you get disability benefits, Your disability benefits are basically your benefits at your full retirement age. So if you get retirement benefits at 62 years old, start 62, then your benefits are reduced by 30%. If you get disability benefits at 62, your benefits are not reduced. So you're already receiving the max from your Social Security disability. So if you switch to retirement, it doesn't affect your check. Actually, you will be switched to retirement benefits automatically once you turn your full retirement age, but it's just a bureaucratic thing where they stop taking money out of the Social Security Disability Trust Fund and they start taking out of the Retirement Trust Fund. Your check and everything stays the same. Okay. All right. So you're receiving disability benefits on your record, and you're receiving survivor benefits. So good on you that you realize that you can receive both. One offsets the other, but yeah, you're doing the right thing. If you are saying that you started your retirement benefits, she added, I am not receiving disability. Okay, so you just happen to be disabled. You didn't file for disability benefits. You just started your retirement benefits. So yeah, you've already started your retirement benefits and you're receiving survivor benefits. So you're technically receiving two checks, but one offsets the other. So if you wait until your full retirement age, then it doesn't matter because you already started your retirement benefits on your own record. If you are just receiving survivor benefits and you never touched your benefits on your own record, then yeah, you just check your retirement benefits, your benefit amount on your retirement benefits on your own record. And if it's going to be more this year, next year, 69, 70 years old, you just figure out when you want to jump over from survivor benefits to retirement benefits on your own record. So yeah, thank you, Deb, for qualifying that. And so I could give you more accurate information. So anyone know if there's an IRMA rate table? I want to know how much I need to pay if I sell my house at a certain price. Yeah, it's you can go on Medicare.gov. I've got it on my website too, mygovexpert.com. Remember, the IRS allows that if you're single, $250,000 exclusion. If you're married, it's $500,000 exclusion. So anything over those numbers will be counted as your adjusted gross income, and then Social Security, the IRMA, well, Medicare IRMA uses a MAGI, a modified adjusted gross income, which adds back any foreign income or tax excluded municipal bonds and stuff like that. But yes, Tricia, I did call chapter. I just want to see for myself what's being offered out there. There you go. That's what you do right there. So we're coming up this week is the annual enrollment period. So it doesn't matter who you contact, make sure you're prepared. So you make sure you get the best plan for you, have your current plan so you can compare it, find what your providers, if you want to keep a particular provider, your hospital, your clinic, your particular specialist or primary care physician, make sure you have that person's name and you get a plan that covers that one. You find a plan that covers your prescriptions, the correct prescriptions, the right dosage, whether it's extended release, all that information. If you want to use a particular pharmacy, make sure you have the name of that particular pharmacy you definitely want to use if you want to use that. If you have particular priorities, you want to get more dental, you want to save more money on hospitalization, whatever the case may be. And then once you sign up for a Medicare Advantage plan, the most important thing is the other 364 days of the year. You have to keep on it. And make sure you fight for everything, prior authorizations, networks, pricing, and all that stuff. So, and that's why we recommend, my son and I recommend Chapter. They'll help you out 100% free like everybody else, but they also help you out those 364 days of the year. So if you find a plan you like, they can switch starting October 15th up until December 7th. Don't wait till that last week. And then your new plan will be effective January 1st. So, let's see, Black Preacher Man 1, disabled veteran with free health care through various hospitals. Do I need to keep paying Part B? It really depends on your particular situation. Okay. And then thank you for the donation. Appreciate it. So yeah, this is a question we get a lot here. You get your health care through the VA. and you're happy with it up until now. So you're like, why waste $185? Because you're not on TRICARE for life. You're not retired from the military. Like, I only did 8 years in the Marine Corps, so I'm not retired. I wouldn't be eligible for TRICARE. So it sounds like you're in that situation too. So you just get regular VA clinic benefits. So you don't have to sign up for Part B if you don't want to, and you're happy with where you're at. So the focus is on $185. But the way things are going now with all the cuts to the VA and all of that, every year you delay, every 12 months you delay signing up for Part B. If you change your mind later and the VA clinic, this customer service gets terrible, or they cut back, or whatever the case may be, and you lose or you have an issue, then you don't have Part B, and you're going to be penalized for the rest of your life. 10% for every 12 months you did not have Part B. So maybe it might be a good idea. There's plans out there specifically for vets like you. They're called Patriot plans or Honor plans. They're Medicare Advantage plans, and they will pay for your Part B premium. $50, $100, $75, $185. It depends on what's available in your particular area. And most of them don't have prescription drug coverage in them. Medicare Advantage plans are Medicare Advantage, MA. But then they're MAPD with prescription drugs. But those Honor veteran plans, they're just MA without the prescription drug, because that's one thing the VA does is really, really good, is they have really good prescription drug program because they are allowed to negotiate. Medicare, until recently, they couldn't negotiate. So, so you sign up for one of those Medicare Advantage only plans without the prescription drugs. And then see if, they'll pay any of that $185. And that way you've got a fallback in case anything happens, and, you're not losing the full $185. So see if there's one available in your area. You can call Chapter or whoever, someone you know and trust, and they can check to see if one's available in your particular area. Other than that, as I mentioned, if you're really struggling across the board, then definitely call and apply for Medicaid. So, should someone wait until 70 to collect Social Security, planning on retiring into this year and trying to figure out if the wait is worth it? Nobody can tell you unless they ask you a bunch of questions. How healthy you are, what kind of gene pool do you have, your family, how long do they live? Do you need the money? If you need the money, it's a slam dunk. Start it. Are you currently working? If you under your full retirement age, and you're limited to the amount of money you can make, and that's $23,400. Anything over that, Social Security holds back $1 for every $2 you go over. And then, the big one, a lot of people are deciding to pull that trigger is because they're like, hey, I want to go ahead and get as much money as I possibly can. Some people said, Ed, stop scaring people. Politicians will fix it. They'll do the right thing. And I say, well, they had 40 years. And the reason they're waiting till the last minute is because when you get the last minute, when they finally come around and they say, hey, okay, we've got 10 more checks. Your check is going to be cut, by 23% in a few months here this year. Then, politicians are going to say, hey, we've tried nothing for 40 years and we are all out of ideas. So it's time we just gave Social Security over to Wall Street, which is, I would argue, their intention the entire time. So let's see here. Frank, I'm 67 and a half. And to finish, remember, if you wait till 70, you get those delayed retirement credits, 8% increase. So if your benefit amount is $1,000 at your full retirement age, let's say your full retirement age is 67 and your full benefit amount is $1,000. Then if you wait until 70, it'll be $1,240. Yeah. But then if Congress doesn't fix this, then it'll go back to the 1,000. So, yeah. Got to laugh or keep her from crying. So, does it still make sense to wait to start? Oh, okay. I already answered that one. I think I had another one I popped up there. When they use words like fairness, it's always detrimental to the taxpayer. Yes. When Biden passed it, it's unique. It was supported by both houses. It was supported by President Trump, President Biden, the Social Security Fairness Act, which is 100% unfair. And the people that are, the millions of people that benefit from that, nobody understands what they got. Nobody understands it. I've had one person reach out to me that says, oh yeah, I know it's not fair, but I'm keeping the money. I'm like, more power to you. You know, you understand that the Social Security Fairness Act is not fair, but you say, hey, I'll take the money. So was the old system unfair? Yes. Is the new system unfair? Yes. And these are predominantly teachers, firefighters, police officers. And I think they teach their kids in their community, two wrongs don't make a right. But in this case, they forgot about that old adage. So I really like your program. You're a wealth of knowledge, but your left-leaning political comments and your disdain for capitalism really annoys me. Capitalism, yeah, is, you know, but late-stage capitalism, where we're coming to now, you know, 50s capitalism, where people were making money and, you know, people could afford a home and a car and all that kind of stuff, you know, wasn't the great in terms of culture, but economically, we were very good in the 50s and 60s, but it all started going wrong in the 70s, and particularly on steroids in the 80s. So, yeah, so there's different levels, different stages of capitalism. I'm not against capitalism. I'm against kind of the slow increase of the wealth at the expense of others. The One Big Beautiful Bill is a perfect example, one of the greatest wealth transfers in U.S. history, from the poor, people receiving Medicaid, food stamps, and the vulnerable population. They're paying for tax cuts for billionaires and large corporations. So yeah, capitalism is awesome, but our current form, not so much. Why is the American taxpayer always last? Can't we make America first without lobbyists? Not with Citizens United, where, you know, speech is, or money is speech. So test that. Next time you're pulled over by a cop, pull out a wad of cash when they're about to give you a speeding ticket, pull out a few $100s and say, here, this is my free speech. You're going to be arrested for bribery. But in the political sphere, it's not bribery. So when will we receive our $2,000 rebate checks from Trump? Yeah, no. There's another YouTube channel out there that's saying, oh yeah, there's more money coming. And yeah, yeah. Until you see, where's my slide here? I have here's the key. Here's how you figure out whether, so if you see social media people out there talking about more money coming, yada, 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 here's the definitive way to determine whether you're actually going to get money, is if you see the president of the United States in front of the flag behind the presidential podium saying, I am such an awesome person, and checks are in the mail. And until that actually, you know, gets into your pocket, then yeah, it's all BS. So because politicians love to pat themselves on the back, it doesn't matter who they are. They love to pat themselves on the back when they give you money. I would say it's kind of a bribe. Going back to George Washington, he used to give people beer when they voted for him and stuff like that. But anyway, yeah, until you see that, it's all BS. It should be illegal for donations from lobbyists on behalf of any foreign country. Yeah. If they change full retirement age, would that potentially impact those that are near retirement, say within the next 5 years? It really depends on how they do it. I mean, Congress could say, hey, we're going to do it effective today, tomorrow. Or they could say, oh yeah, it's not going to affect. That's how they did it in the 1980s. And the Greenspan Commission, they changed it in the early 1980s, and it just took full effect this year, 2025. So was that 45 years later? That's why people ask, what do you mean by 40 years? The last time Congress did anything to really significantly shore up Social Security was over 40 years ago. And that was the Greenspan Commission, that they raised the retirement age and did a bunch of other stuff. And so that 40 plus years ago, didn't take effect until this year. Effective this year, if you were born in 1960, your full retirement age is 67, the full 67. Last year, your full retirement age was, 68 in 8 months, 10 months or so. So it's finally took in full effect. They added a little bit at a time. So next election, we need someone who will leave Social Security alone and not cut benefits. Okay, that's, I can see the second part, but the first part is, it's like the fire department or someone coming to a house that's burning down, and they say, and they just watch it, and they say, hey, and they don't throw fuel on the burning house. They just sit there and watch it. That's what's happening with Social Security. We need someone to just kick the can down the road and say, yeah, we're not going to do anything. We're not going to cut benefits. We're not going to raise the retirement age. Okay, that's fine. That's a good start, but something needs to be done, because right now we've got 40 years of people not doing anything positively for Social Security. And so something needs to be done. Something has to change. And that's why, we talk about this on a regular basis. But more people need to reach out and say, hey, something needs to be done. I appreciate you saying, Mr. President, that you're not going to raise the retirement age. Perfect. Awesome. Great. But how are you going to fix it? Biden didn't fix it. Obama didn't fix it. Clinton didn't fix it. Trump didn't fix it under his first term. So we're not blaming the current president. We're blaming the last 40 years. And the reason is because, one of the major reasons is because we ignored it, and we just got sucked in by all of the distractions. If you retire and claim Social Security before 65, what do people do for health care coverage before Medicare kicks in at 65? Then the Affordable Care Act or whatever other private health insurance. So, yeah. And now the Affordable Care Act, that's the reason for the government shutdown, is because they say, hey, there's millions of people that are going to lose their Affordable Care Act. There's millions of people that are going to lose Medicaid, and not those people you think. Regular people that are actually eligible for it, because you can't cut $1 trillion out of that budget and not have it affect everybody. And so that's what the shutdown is for. We have to restore healthcare, and the only leverage they have is a shutdown, unfortunately. What do I do? No creditable coverage letter from insurer. Supposed to get a letter by October 15th. Okay, so you have a private health insurance plan or something from your current work, and so you're not signing up for Medicare because you currently have creditable coverage from your current employment or your spouse's current employment. So yeah, I would reach out to them. You don't necessarily need it. So if you're turning 65 October and you're saying, hey, I have to prove that I have creditable coverage, you don't. You just don't sign up for Medicare. If you're currently receiving Social Security benefits, you do have to sign up for Part A. That's automatic, but that's zero premium. But if you don't want to sign up for Part B, just don't sign up for it. And then 5 years, 10 years later, once you lose your health insurance, then you have to prove it at that time, and there's a form that you do it from your employer. Give me a little bit more information on that. What were you talking about? And remember, if you've got a longer question, someone said that Nona says there are only 200 characters allowed per chat. So some people want to give me a longer question, which is awesome. I like the longer questions because we need to get into a little more detail. But if you go onto my website, you can do that on my website. You can never see it, but on the bottom left, let me see if I can do this without messing it up. On the bottom left, there it is, right? I always mess it up. On the bottom left of my website, there it is right there, mygovexpert.com. The little question and comment, you click on that, and it brings you to a little video place that you can go. Okay, you got to press on the camera icon, and it brings you there. And I explain what to do, and you just record your question. So you can record a longer question. You have 2 minutes to record a question or a comment or whatever you want to do. And then speaking of that, I have I think I have about 3 of those. Let's actually get into some of the video questions right now.
Hi, Ed. I just recently filed for Social Security retirement, and I'm 66 now. Should I continue with this application?
It really depends on your particular situation. Nobody can tell you. There's a bunch of videos out there that says, yeah, you have to file at 62 or 65 or 67. It's, you're dumb if you do or don't, whatever. No, it's your particular situation. If you need the money and you're not working or you're working below the annual earnings limit, the 23,400, then hey, if you need the money, go for it. It's yours, get it. But if you're working and making over 23,400, remember Social Security holds back $1 for every $2 you go over. So that might stop your benefit for however many months. But yeah, if you need the money, go for it. If you have a spouse that's waiting for you to file for benefits so they can start their spouse benefits, then that's another big reason to go for it. Or if you have children eligible for benefits. So it really depends on your particular situation. But it sounds like you already started the process. And if you already started the process and you change your mind, don't sweat it. Contact the Social Security person and say, hey, I changed my mind. I'm going to go ahead and wait till next year. No problem. If they already adjudicated the claim, then they'll have to go through, then they might, oh my gosh, this got to go. Don't worry about it. It's their fault. It's their issue. They have to do it. People did it all the time, and it's just, you have to delete the claim out. So it's no big deal. So if you want to stop your benefits, you can stop your benefits. No problem whatsoever in terms of, because you haven't got your first check yet. So you just call them. But if your check is already gone out, then you have to actually withdraw your application and then return that money. But right now it sounds like you're still in the process, so you can change your mind if you want to. No big deal.
Hi, my name is Sheila, and I'm trying to find out, is my great grandbaby that I adopted a month ago is entitled to my husband benefits. He died in 2007, and I've been getting his benefit for the last 2 years. Her parents has been incarcerated for the last 4 years, and I have adopted her a month ago. I've had her for 3 years. Is she entitled to any of his benefits?
Okay. You adopted, wow, number one, there's a lot of people out there adopting or taking care of grandkids. They thought that whole chapter of their life was over, but yeah, life is what happens while you're making other plans, right? So you adopted, so the child is eligible 100% for benefits on your record, but you have to be receiving retirement benefits or spouse benefits or something like that. So it sounds like you're receiving survivor and spouse benefits off of his record. So I don't think, unless there's some type of extenuating circumstance, you can always try, but I don't think you're going to be able to get, they're going to be able to get benefits on surviving spouse benefits. Because technically, there's some exception if you're married, but anyway, but if you're receiving surviving spouse benefits and you're waiting to file for benefits on your own record, then that's a slam dunk. Then you can go ahead and file for benefits on your record, and then your child, your adopted child, can get benefits on your record as well, 50% of your full benefit amount. So I'm not sure whether you're getting your benefits and survivor benefits. If that's the case, then yeah, 100%. And I would do it soon because you just adopted the child, what you said last month. So you want to make sure, call them up immediately and set up an appointment and check and say, okay, hey, I'm receiving the surviving spouse benefits. Is there a possibility? Because we were, married at that time and I'm adopted but I'm, so try it. But definitely the child can receive benefits off of your record. So, all right, got one more video question.
Hi, Dr. Ed. Yes, my name is Gypsy, and I'm in Michigan. And I have a question. If a person is on SSI and they're 69 and they're disabled, and they also have their insurance company, I believe they have the dual complete plan with Medicare and Medicaid. My question is that person at risk of having their SSI money cut or taken away from them?
Okay. For SSI, as of right now, no. So SSI, supplemental security income, the welfare, the low income system that Social Security administers. As of right now, no. And you are, because you're after your 65th birthday, you're no longer on disability. You're just on what's called SSI aged. So for her or anybody else out there that is beyond the age of 65 and is struggling, and their benefit amount from Social Security, and they have no other real income or resources, they can get SSI aged. And the max you can get is $967, unfortunately. There's some states that pay a state supplement of $100 or $200 or something. But yeah, as of right now, there is nothing in the works to reduce SSI. There's some things in there to recalculate food and housing support. That there was a law that was changed last year that made it more favorable for those people receiving what's called an ISM, income support maintenance, for food or housing. And they're talking about getting rid of that law because, it was a Biden law. So anything Biden or Obama they don't like. So they're talking about getting rid of that, but nothing as of right now. That's a proposal. In terms of, so she's receiving SSI and Medicaid and Medicare. When people receive Medicaid and Medicare, they are eligible for what she talks about as a dual eligible plan. So a Medicare Advantage dual eligible plan. One thing that you probably will possibly lose money on is what's called the VBID program. It's a program for those people that have that dual eligible plan. There you get those food cards or over-the-counter drug cards. That program is ending this year. It's ending. So there's another program, but it's a lot less generous, and there's a lot more hoops you have to go through to get it. So you definitely need to check your plan for 2026 and try to compensate for what you're going to be losing with your current plan. So you can reach out to Chapter or whoever helped you out, and they can see what's available in your area and get you all set up. So, all right, we are over an hour. I ran out of time as usual. Unfortunately, still got a lot of questions. We get one more. I don't recognize Robin, so let's see what she has to say. He or she. I'm 65, getting remarried after collecting a former spouse's Social Security for about 2 years. Do I have to pay anything back? And do I have to wait 1 year to collect off the new spouse? This is a strange one. Not for you, but it's just a weird policy. So you're past your 65th birthday, you're past your 60th birthday. So if you're are these surviving spouse benefits? If they're surviving spouse benefits, you can continue to receive the surviving spouse benefits and nothing happens. Getting remarried, so you haven't been married yet. So if you don't have to wait the year sometimes when you get remarried. If your new spouse is receiving benefits as well, then you might be able to switch over to your new spouse without the 1 year. Because you have to kind of think about it is, so like you're receiving, your benefits on your own record and you're receiving spouse benefits, and then you get remarried to someone. And if they say, hey, you have to wait a year, that's a year without benefits, and a lot of people struggling. So sometimes you do have to wait a year if you're not receiving benefits, but if you're already receiving benefits, they usually don't make you wait the year. So, but I would file. You have to notify Social Security of the marriage anyway, because if you don't, again, if your previous spouse is still out there alive and kicking. If they're deceased, that everything's different. But it sounds like it's not a surviving spouse claim. So you need to contact Social Security and tell them that, hey, I'm remarried, and therefore that stops the benefits from the living spouse. And then you say, hey, here's the person. Are they receiving benefits? You were receiving benefits, and then you take a new claim for new spouse benefits under the new spouse. So, all right, we are way over time, and I will be back again tomorrow, and we'll get into another topic of the day. I think tomorrow is going to be probably about disability. That's one thing the current administration is trying to make it more and more difficult for people to get and keep their disability benefits. So we'll talk about that tomorrow, and then answer a whole bunch of questions. All right, y'all take care. Have a beautiful night, and please take care of each other. Bye-bye.